Shannon Miller is a gymnastics superstar, the most decorated American in her sport. Among her many awards are 2 Olympic gold medals.
It's almost indescribable to be up there, gold medal around your neck, seeing the American flag being raised, hearing your national anthem.
Shannon is also a survivor of ovarian cancer. The skills she learned as an athlete helped her face a major challenge to her health.
Gymnastics taught me so many wonderful life lessons. I learned how to set goals and follow through.
The first goal is to learn about the choices you will have on the road ahead.
There are more treatments for ovarian cancer now than there were in the past. It's a different disease today than it was even 15 years ago.
The ovaries are an important part of a woman's reproductive system. They manufacture hormones and send eggs to the uterus. But sometimes unwanted growths develop. A simple cyst is a fluid-filled sac that is not cancerous. A tumor is a solid growth. It can be either benign, meaning non-cancerous, or it could contain cancer cells.
A cancerous tumor in the ovary is different because the cells will keep growing and keep dividing unchecked, and even have the ability to spread outside of the ovary and go to other parts of the body.
All women have some risk of developing ovarian cancer. One risk is simply getting older.
Ovarian cancer is more common in women over the age of 50 than it is women under the age of 50.
But at any age, keep in mind that you are not alone. Thousands of women are diagnosed with ovarian cancer every year.
My diagnosis was an absolute shock, absolutely out of the blue.
When ovarian cancer starts to grow, it doesn't always cause symptoms, or at least none that you recognize. Shannon was a busy working mom with a 1-year-old son. After she began learning about the disease, she realized she had been brushing off some typical signs.
My husband reminded me, hey, sweetie, you were actually complaining of a lot of stomach aches.
She also experienced rapid weight loss and bloating, just some of many signs that might or might not be connected with cancer.
And that's because the symptoms of ovarian cancer can often be very subtle, and they can mimic symptoms that women have from many more common and benign conditions.
Barbara had always been on the lookout for symptoms. Her mother died of ovarian cancer at the age of 47.
You know, you always have that thing in your head, you know, your mom died from it, so any little thing, I was very watchful.
So when she felt cramping 2 years ago, she went to her gynecologist. She wound up being diagnosed with ovarian cancer and went through treatment. After a year in the clear, the cancer came back. This time, the symptoms were very different.
I just had this pain running from my vagina right up to my belly button. And it was very, very painful.
Whether the symptoms you're feeling are slight or strong, don't hesitate to talk about them with your healthcare provider. Frances has no family history of ovarian cancer, so when an ultrasound examination turned up a tumor 6 years ago, she was taken by surprise.
I was absolutely floored. Never expected it. I just thought I went for the sonogram, everything's fine, I'm going home, and I got the call the next day.
When ovarian cancer is suspected, the patient should be referred to a gynecologic oncologist.
A gynecologic oncologist is a specialist who's trained to care for women with ovarian cancer. The cancer is in the ovary.
It might take several kinds of tests to confirm the diagnosis. The next step is finding out if the cancer has spread. Ovarian cancer is described in stages, from stage 1, where it's contained in the ovaries, to stage 4, when it has traveled beyond the abdomen.
So an example of a stage 4 cancer would be cells that had spread to the lining around a woman's lungs or to her liver or other organs that aren't anywhere near the ovaries and the pelvis.
At any stage, the diagnosis can be frightening to hear, but you are not alone. Your healthcare team is ready to help you understand the many choices available.
And it's okay to have that pity party and those days that you want to cry and scream, and it's okay to do that. But I think at the end of that, you sit up and you plant your feet firmly on the ground and you keep going. You take that next step.
Okay, so Barbara, I'm very pleased with how you're doing so far with the chemotherapy.
There is no one-size-fits-all treatment for ovarian cancer. Individual choices are made depending on a woman's cancer type and stage, her health, and what works best for her.
Because every treatment has side effects. And one way that we determine the right treatment for somebody is to balance the effectiveness of the treatment with the side effects.
The main treatment for most ovarian cancer is surgery. It's used for staging, to look for the spread of cancer, and to remove it, called debulking.
Debulking surgery, the purpose of it is to remove all of the cancer, whether it's limited to the ovaries or whether it's spread anywhere else in the abdominal area.
Debulking surgery might require removal of the reproductive organs, a hysterectomy. So women need to know beforehand that surgery could affect their ability to have children. Shannon wanted another baby, but her first priority was getting healthy.
And so I looked at the doctor and I said, well, right now I have one little boy and he needs his mommy. So I'm going to need you to be as aggressive as you can possibly be and make sure that I am here for that child.
Shannon opted for surgery followed by chemotherapy. Chemo, as it's called, uses medicines that kill rapidly dividing cells. Some newer types of treatments are called targeted therapy because they zero in on molecules that spur the tumor to grow and spread. Targeted therapies can work in a number of ways. Many targeted drugs go after the cancer cell's inner workings, the programming that sets them apart from normal, healthy cells. They can hone in and exploit a weakness in the cancer cells. You might also consider participating in a clinical trial where new treatments are tested.
We don't know yet whether the medications available in clinical trials are beneficial for the treatment of ovarian cancer, but by participating in clinical trials, we can help to advance the care of this disease and help new treatments become available.
With such important choices to be made, you need to feel comfortable communicating with your healthcare provider. Remember, it's okay to ask questions and insist on getting answers you understand.
I think of my healthcare team a lot like my gymnastics team. It's not just you have to rely on that team and you have to have that open communication.
A genetic test is basically a blood test that you can have, and it can test if there are changes in the makeup of your genes that might make it easier for cancer to develop in you than in somebody else.
Two important genes related to ovarian cancer are called BRCA1 and BRCA2. If they have undergone changes, called mutations, the risk for cancer rises. So even women who have already been diagnosed with ovarian cancer should consider being tested for changes to these or other genes linked to cancer risk.
Knowing those genetic testing results may help them to make treatment decisions, regarding treatment of the cancer they have, and it may help to guide surveillance and screening recommendations in the hopes of preventing a second cancer.
The results could also mean other women in the family should be tested.
I got genetic testing because I have a daughter and I have 6 granddaughters.
Both Frances and her daughter tested negative for BRCA1 and 2 mutations. But Barbara's outcome was different. Because their mother had died of ovarian cancer, when Barbara was diagnosed, 2 of her sisters were tested, and so was she. She says they all were found to carry the mutation, so they're taking action.
If a woman finds out that she has genetic predisposition to cancer, she can speak with her healthcare team about ways that she can reduce that risk. It might be through screening, it might be through surgery, it may be through medications, but there are things you can do.
The treatments that ovarian cancer requires, surgery, chemotherapy, targeted therapy, can all take a toll on the body. And it's important to remember that good nutrition, regular exercise, and other healthy behaviors can really help to keep your stamina up, to keep the side effects at bay, and to get you through that treatment and then ready for the next phase of life.
It is empowering, and it helps fight against some of the depression and other things that a cancer diagnosis brings along.
Frances and her husband Erwin know fitness is great for the whole family. Making good choices is just one of the things they do together.
Since our cancer and since we both wanted to lose weight, we stick to very healthy foods.
Women are so often the caregivers. Sometimes they have to learn to ask for help. Shannon Miller found she needed to overcome her natural tendency to be in control.
Because without my health, I can't be there for all of those who are depending on me. So you know what? It's okay to take a day of rest.
I want you to write down some of the questions that are from the computer. You could ask.
Frances relied on her daughter to help her learn more about coping with chemotherapy. And when it caused her to lose her hair, her husband lifted her spirits.
And he turned around to me and he said, "You look so cute."
It can also be helpful to have someone come with you to appointments.
I think it's really critical to have people that you can trust to come with you to visits, to doctor's visits, to ask questions, to be your second set of ears or your note taker and help you navigate all that very complicated information.
I think it's also a very good idea to sort of have an agenda, meaning make lists of questions before you go, and you can make sure that they're all answered before you leave.
And don't be shy about asking your healthcare team about managing the cost of your treatment.
If you've been diagnosed with cancer or you have suspected cancer, your hospital or healthcare provider can work with you to get insurance and to get coverage so that your care will be provided to you in a financial way that you can handle.
We're walking, yes indeed.
Not long after Shannon Miller completed treatment for cancer, she had yet another reason to celebrate: the birth of her daughter.
And now all of a sudden here she was, our little bundle, and she's just a happy little thing, and we just feel so blessed.
Every woman's journey with ovarian cancer is different, but by working with your healthcare team, you can make the choices that are best for you.
I think overall, keep fighting. You've just got to get up each day, put one foot in front of the next, and just keep fighting and enjoy every moment that you can.